You have incontinence, you have pelvic floor dysfunction, and no one has ever looked at your inner thigh and its impact of the health of your pelvic floor muscles. That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy, and one of the things that I've noticed the most about people with pelvic floor dysfunction is issues related to their thigh being attached to their pubic area, private area. Is it because it's too private? I really think it is, because a lot of times when people end up with incontinence, and unfortunately we're seeing more and more people who don't have the stereotypical characteristics and category of what pelvic floor sufferers belong to. So they're not necessarily women who've gone through pregnancy or childbirth, or smokers or obese or things like that. We're actually seeing them in much younger males and females. So that's the old ways of how things were. By the time they actually have incontinence per se, they've gone through a lot of pre-incontinence steps. One of which has to do with, it could be as simple as knee issues, could be as simple as lower back issues or sacroiliac joint problems. Then you're thinking, oh, well, you know, I just need to work out, whatever. So when you seek care, either in a physical therapist office or in a chiropractic office, it doesn't matter. This area does not get looked at. Maybe close, but not at the attachment. I totally get it, but it's not, it's part of the treatment. So that area needs to be addressed. If it is the attachment of that is too close, too tight or too painful, that area needs to be addressed. If your IT band is tense, you already have this issue here, because there are forces that are trying to bring your legs out or rotate them out, and so to counter that, these have to be engaged. If you have a history of knee problem, you have that involved. So just wanted to bring that to your attention, because we're too busy looking at things just like that when it's the whole picture we should be looking at. If you have any questions, make sure you contact me using one of the methods of contact in the description box. And while you're at it, subscribe to the channel. Thanks for watching.